This hospital, called Sveta Petka in Vidin, Bulgaria, has been dominating the headlines for weeks. 43 people from the medical staff, over 10%, have become infected with the coronavirus to date. Presumably, the virus has also been passed on to patients. Staff at the hospital lament the lack of protective gear and hygienic safety measures. Mariana Verbaska has been working as a nurse at the hospital for 20 years. She's the only one who has publicly spoken up about the shortcomings and wrongdoings.
When COVID-19 and the epidemic were officially announced, we received one face mask and 2 pairs of gloves for a shift. We were told that there weren't any more available, but that wasn't the case. I found out later that the hospital's pharmacy had more than enough left. All of the protective gear stayed there, and I don't know why they didn't distribute more of it.
Because of the threat posed by corona, camera teams are not allowed inside the hospital. Mariana used her smartphone to record these videos. Years of funding cuts to the Bulgarian healthcare system have resulted in a lower quality of healthcare, far below the EU average. Bulgaria faces a lack of doctors since they earn better wages abroad. Working conditions are generally bad for the whole medical staff. That's why there's a high risk of infection at the moment.
Especially here, in this space. Just 2 toilets for the entire team of 20 that's on call during a shift. For the people of the medical emergency team, the drivers, and so on.
A lack of protective gear and necessary precautions? Sveta Nadenova, who heads the clinic, disputes Nurse Mariana's accusations.
Information has been manipulated. I can state that all of this is wrong. The idea that this hospital, its management, and the local authorities had not acquired and secured enough protective gear. That's a lie.
Not only do hospital staff complain about the conditions in the hospital, patients are too. Peter and Olya Milanovi's father died of COVID-19 here a few days ago. He was taken to hospital because of a heart condition. Mariana's relatives are now getting themselves tested.
What's the problem? Better to do it here than directly next to patients with COVID-19. That woman there is surely positive.
So far, Peter hasn't received an answer as to whether or not his father got infected with the virus in the hospital.
For 2 days, nobody answered the phone, and they closed the hospital ward that he was in. Somebody needs to take responsibility for what happened. Someone needs to reimburse the people who have suffered due to false decisions. That needs to be compensated for.
Vidin has registered an especially high number of corona cases. The city is located in one of the poorest regions in the country. Unemployment is widespread. By now, some hospital staff have quit their jobs. The authorities are having difficulties finding new staff in times of the crisis. But the city's mayor says the main reason are low wages.
The average age of doctors, nurses, and other medical staff working at the hospital is 55 to 60 years. They earn 880 leva. That's 440 euros. What can I say? That's half of what a bus driver earns here.
In terms of the hygienic conditions, the mayor says the situation of Sveta Petka hospital has significantly improved now.
My colleagues might have underestimated the situation, but you can see with your own eyes that all necessary measures were taken. Anyone working on the front lines, meaning 130 cases, was tested. Every single person.
Mariana's experience at the hospital has been quite different. She wanted to know if she had possibly been infected with coronavirus at work. But she was told that was only possible at her own expense.
I went to the microbiology department to ask for a rapid test. I was told that I would have to pay 50 leva, which is 25 euros. A receipt was then made out for the test before I could take it.
Despite everything, Mariana doesn't want to quit her job or move away from Weiden. The Sveta Petka hospital is like her home, she says, and giving up is out of the question.